3 in the CHN advocacy training sessions, and we're really glad you're here. This will be kind of an intro overview to our campaign work that we're going to do together, and we have a pretty packed 90 minutes. So we'll get started. So the overview is that we'll talk about our mission, who we are as a health community, why we're here, the purpose of our state level advocacy. We will celebrate and get to meet our 5 awesome advocacy campaign co-leads, sometimes called ACCs. We'll talk about our values and norms as an organization and community. Talk about coalitions and what it's like to work in a coalition as a CHN representative. And then talk about how we are going to select our campaigns, which I'm sure we saved kind of maybe the most exciting for last. And then we'll round out right before 1:30. So Shui and I let everybody know that Amanda's sick and we're kind of improvising a little bit. And if you are just joining, if you could mute just for audio reasons, that'd be great. Okay, so let's jump in with Thea, starting us off.
Hi, everybody. I'm excited to be here and get this training and start being of use on this hugely important issue. So I want to just throw out our mission. I'm going to talk about it at a high level explanation and then turn it over to a couple of my colleagues here to delve into some of the areas further. So first, let me read it to you, and then I want to just point out a couple of keywords and talk about them if I could. So our mission at CHN is to organize and mobilize the California health community to advocate for equitable systems-level climate action. So what does that mean? Let's take it apart a little. Let's start with that first line, organizing and mobilizing. That's what we're here to do. We're here to bring new additional folks into this hugely important issue of climate challenge, into the climate movement. That's our purpose, to organize and mobilize. California health community, I'm going to leave that alone because Zoe's going to explain that in more detail and define that for us. So let's jump to the third line where it says, what are we going to do once we organize and mobilize these people? Why are we bringing them in? We're bringing folks in to advocate for equitable solutions and equitable actions. Like so many of the issues facing the US and the world today, climate change is hitting the people who don't have an equal voice even harder. The people who didn't contribute hugely to the problem are now experiencing the problem and don't have as much voice as other people. And that's why we're saying we need to advocate for equitable solutions. The next aspect of the mission that I want to call out is the systems level. And what that means is we're looking for actions that have bigger impacts, more impacts than just over 1 or 2 individuals or 1 or 2 small neighborhoods. We're looking for actions that create some systemic level, bigger changes. And the final thing that I want to point out with the mission is the word action. The healthcare community, we're listened to in a different way than other people are. We have levels of expertise and levels of respect that put us in a unique position so that we can influence other people hugely on this really important issue. So I love this mission and I'm ready to go with you guys. Thank you, Ashley, for allowing me to explain this slide.
Love it. I love it. That was a real great, wonderful breakdown. Yeah, I think if we could have we should bold equitable. And a lot of times I've heard people say climate action now, which that's actually a different group and they're doing great things. But for sure, that is what we are oriented around. So wonderful. Thank you so much, Thea. And now to Zoe to kind of get deeper into what do we mean when we talk about the health community.
All right, thank you. Hi, everyone. I'm Zoe. I'm really excited to be here. And so, definition of the health community. We define health not just in terms of physical well-being, but also in terms of mental, social, and environmental well-being. This broad definition of health requires the engagement and recognition of a wider health community invested in promoting and providing individual and public health. Climate Health Now defines this wider health community to include, but not be limited to, those involved in public health, clinical care services, community healing, health sector administration, health research, and development of healthcare products. We welcome trainees, students, and those who have retired from these fields. And I love this definition. I actually specifically asked Ashley if I could read this slide because I'm not a healthcare practitioner. I'm part of the health community. I have a background in public health, and health affects everyone, every being on this planet, and our climate affects every being on this planet. And I personally believe in a One Health or a planetary health perspective that everyone's individual well-being affects the group and systemic well-being of our planet. And so I really like this definition. I'm really glad that Climate Health Now includes everyone, not only in the organizing and action of the Climate Health Now community, but also in taking into consideration who our work affects.
Wonderful. Yeah, and so if you may hear, and this happens on accident, and we're helping each other expand our community and who we help feel really comfortable working with us, because we need the biggest tent. We all know that. So if you hear a fellow well-meaning CHN member say, well, CHN being doctors, we should really do this, and we empower everybody to, with love, say, oh, I think what's so cool about CHN is it's the whole health community, and just kind of lovingly expand our sense of identity, because we all have, you know, really valuable voices, like Thea was saying. So that's who we are. Thank you so much, Zoe. And then to Shuin for what we are doing together as a community around this mission.
Okay. Hi, everyone. I'm Shuin. I'm a nurse practitioner in LA, and I'm also on the statewide leadership team. And so why we are here. So what is our purpose as the, advocacy campaign leaders, right? So Ashley, can you click? Or I don't know. Oh, there we go. Okay. So usually, if you guys have ever attended any of the organizing fellowships or seminars, it's really important to have a shared purpose. And the template that's usually used is the we are who, and our shared purpose is to do what by how. And so for this, we wanted to kind of clarify that. So we are, the advocacy campaign co-leads and the people that support them. And our shared purpose is to catalyze equitable statewide climate policies, right? So the key words here, they're in our mission as well, right? But again, this one is specifically focused on these statewide climate policies. And hold on, let me admit people. Okay, and how, right? We are working in collaboration with coalition partners and organizing our members and developing action opportunities for CHN members to be climate health advocates. CHN does do a whole variety of
Sorry.
Yeah, I'm muted.
Oh, you got it. Okay. Thank you.
Yeah, sorry, Vanessa, I just muted you. But essentially, CHN does a lot of different activities, but this group specifically is working on trying to figure out ways that we can organize our members around these statewide climate policies and have actions for them. A lot of people in CHN are really new to, advocating for climate. And we've done a lot of different one-on-ones and asks and how people are comfortable, what people are comfortable doing. And we realize, we really need to be very, very focused and very walking through and hand-holding people through a lot of these action opportunities. And so that's what we're going to be doing. Okay, so Ashley, I'll then turn it back to you.
Great. So this is a especially exciting moment because we're introducing CHN's first ever, like really kind of deliberate team of advocacy campaign co-leaders, and we have 5. And we wanted to just highlight that what we're trying to do, CHN is really trying to learn and also practice at the same time community organizing, which a lot of us, that can be a newer thing. It certainly was for me. So, a lot of leadership models are kind of like this. I don't know, maybe this is like U.S. politics or most corporations. And then there's like the kind of anarchist, what is this, like Occupy Wall Street maybe? We're all leaders. And what we're really embracing and trying to learn and practice is actually, sorry, the text didn't come out very well, but the snowflake model of leadership, which is really about interdependent leaders. So where we all have roles to play that contribute and collaborate with each other, but we all have like leadership strengths within us and roles that we can play. So when you hear us talk about a snowflake, this is the kind of diagram that we're talking about, and that's part of what the campaign co-leads are really bringing to life in an awesome way. So this is a part where we talk about snowflakes. Isn't that funny? I thought it would be really funny. Okay, and then the other thing that we really want to, we always come back to a lot of things about Marshall Gann, so you might get sick of him, but I think he's like one of the most amazing people for what he's done, and his definition of leadership is really what we kind of stand on and believe in, that leadership is taking responsibility for enabling others to achieve shared purpose under conditions of uncertainty. So, oh my gosh, we live in times of, uncertainty. Conditions of uncertainty is kind of the definition of our lives these times. But enabling others, we really see the campaign co-leads as enabling all of our members, like the hundreds of members across the state, and that we're doing that in a really interdependent way with lots of support. So here they are, woohoo! We're going to go around, and everybody will have a minute and a half or two to introduce yourself, say, kind of what part of the health community you are a part of or have been, where you live, and then what made you want to join as a campaign co-lead. So we'll start with Vanessa, and we'll go clockwise like this. So Vanessa, we'd love you to share.
Good afternoon, everybody. My name is Vanessa Forsyth. I'm a retired school nurse. I have, been involved with climate health now since pretty much COVID, which changed my perspective on some things, concerned about this existential threat, climate health, and realizing that as healthcare professionals, we have a special voice. I was involved in some legislative efforts with Climate Health Now and other co-collaborators, particularly around the getting AB 579, getting school buses replacements to be electric buses to help decrease carbon gases, greenhouse gases, and some other efforts too. So I think, working with others and bringing others along and using our powerful voice, as we said, we are all impacted by the health impacts, and it is a environmental equitable issue.
Exactly. We're glad you're with us, and Vanessa will share a little bit later with Schwinn about what that campaign work was like last year. Wonderful. And then we'll go to Hina next.
Hi, I'm Hina Fuller. You guys can hear me okay? Sometimes my sound is very low.
Yep. Yeah, you're good.
No, I can't hear. Is there any way you could turn up, Hina?
I don't know how. I don't know why that is. Is it any better or different? Or should
No.
can you, sometimes it helps if I get closer to whatever the microphone is.
Okay.
Lean in a little maybe.
Okay. Is it any different or better?
Not too much. Can you press volume on whatever device you're using and increase the volume?
It's called maximum. Yeah. No, it's only you, or no one can hear me well.
You're not loud, but yeah,
Is
you're
it
kind of,
better?
it's
Is it
just
different?
soft.
Is it any better? I try to
Yeah.
make it maximum.
Yes, much better.
That's definitely,
Yes.
yeah,
Great.
good,
Okay.
thank you.
No worries. Yeah. So I'm Hina Fuller. I'm a psychiatrist. I am in East Bay. I work in Walnut Creek, and I live in Alamo. And I am she. I mean, my pronouns are she and her. And I used to be in New York working with the chronically unhoused individuals, and now in the last 7 years we've been living in California. And I think I was always like interested and scared about climate change related health impacts and mental health impacts, but I was not really feeling so sure how to be effective or do anything other than just feeling outrage or reading news or whatever and then feeling scared. So I think, and even though I was looking in my, I don't know, old emails, that I think I joined CHN in 2020, but I never really even attended any meetings until last year or so. And then when I did attend those monthly meetings, it was kind of interesting. And then somehow doing few things, here and there, it was just made me realize that how empowered and effective I felt. And it was helpful, it was therapeutic in terms of my despair and fear and dread. So I think that's why I'm here. I attended one of the meetings with Dr. Chang, like Lisa Chang, who's here, and that was so, I don't know, inspirational. So I thought that why not try and do a little bit more. So I'm very glad to be here. Thank you.
Yay! And one of the other roles that Hina's playing is part of the CHN discussion club or culture club, I think was another name. So we hear ya. Yeah, it feels better to be working together. Glad you're here, and then we'll go to Zoe.
Hi again, everyone. I'm Zoe, and I live in Berkeley. My pronouns are she, her. I currently work for Greener by Default, which is a nonprofit. I work with hospitals and healthcare institutions to help them implement default plant-based menus for the benefit of the planet, and also the benefit of patient health as well. And my interest, I have been a lifelong animal advocate. My interest in health and animal advocacy and climate health is really all combined together into one big love for public health. And let's see, I graduated in 2021 with my master's in public health from Yale. And before that, I was doing a lot of grassroots work for animal advocacy organizations. I have a lot of grassroots organizing experience around legislative campaigns. And I'm excited to really combine that experience and that passion with health and public health with CHN.
Woohoo! We are glad you're here. Maybe you can teach some of the organizing part too. Really glad you're here. And then we'll go to Thea.
Hi again, everybody. Thea Spitzer is my name. I go by with the pronouns of she and her. What I did when I worked, I'm mainly retired. I have a master's in community health, and I spent my first almost decade with the Red Cross. And then I became a management consultant. And within that scope, I did a little bit of healthcare work. I helped to create the Seattle Cancer Care Alliance. Most of my work as a management consultant has been in the tech sector. But it's been, the key point is whether it's health or a tech or whatever, it's about helping people become more leaders. And I love that. I love that Marshall Gans quote that you gave, the definition of leadership. I so believe in that. So that actually fits with why I wanted to become a CHN ACC. I've just realized over the last couple of years, there is just no way that I want to sit by and assume other people are going to fix this huge problem. I have this compulsion to help be part of the solution of climate change. And like one of you just said a few minutes ago, I'm sorry, I don't remember who it was that said it. I've been searching for a great organization to work with for several years, and I'm just ecstatic to have found CHN. Thank you.
Woohoo! We're really glad you found us too. I think we have Lily to thank, right? Lily Chen.
Yes, I came into you folks through Lily. Yes.
I gotta tell her thank you
Yeah.
again.
Yeah.
Thank
Yeah.
you. Great. And then Alex, we're really glad to finish up with you. Let's hear about you.
Awesome. Thanks, Ashley. Hi, everyone. My name is Alex Chang, and my pronouns are he, him. I'm not currently working in the healthcare field, but I would love the opportunity to do so one day. My parents are both surgeons with Kaiser, so I've been privy to a lot of their experiences, notably how much is wasted in healthcare. Um, I'm from Claremont in East LA County, where the Claremont colleges are. Um, but I'm currently attending UCLA on the west side, where I'm a first-year climate science major. I found out about climate health now through my stepmom, who is a Kaiser OBGYN. And I just kind of felt that the group was like, and all the work that's done here was right up my alley. I was also involved with AB 579 and a few other climate health now efforts last year, especially last summer. That's when I was most involved. Yeah, I think like the rest of you, I think that climate change is the greatest threat to my generation and frankly humanity's future. So I just wanted to start learning as much as I can about climate change, and getting involved wherever I can. And this is a great opportunity for me to start and for me to get involved. So yeah, thank you.
Woohoo! All right, so this is our team. This is our advocacy team for the year. And like I said, we last year we didn't have quite as deliberate of a plan, and we didn't really build teams. So it's very exciting to have kind of this clarity. Actually, it's the first time, and so it's a new year for all of us. And I think one of you I had a one-on-one meeting with, and somebody said like, I'm kind of nervous, and I can totally relate to that, but I think we just are going to embrace the growth mentality that none of us have done this a lot, and we have everything to learn, and it's just going to be fun to do it together. So welcome to all of you, and we will celebrate you too in a kind of upcoming newsletter or message to all of our members too. All right, so I'm going to pass it to Hina to talk about our vision, and then we'll go into more about CHN.
All right. So, it seems like it has been, discussed already in multiple ways, but I think it's a very beautiful summary in a way which we all have been already talking about, that how the CHN's vision is that we are a movement in which entire California health community. So I think that the emphasis here is entire, which include anyone who is engaged in any kind of a health work, and it doesn't have to be a physician, it could be anyone who is involved or engaged or interested in California health community, in California health. So we are entire California health community that bring their health voice to climate advocacy. And I think at some other meeting we were talking about it, that how as health professionals there is more a sense of there's more respect and more some level of gravity when we bring our health voices to different policy issues. Or so I think using that skill and that background adds great weight to whatever we decide to join. And then CHN membership is diverse, engaged, and takes responsibility for system level climate solutions in California. And I think this is a very beautiful, a very beautiful packed sentence, because each word is very, very intentional. Our diversity through, as people, but also through our expertise, our professions, it all becomes our strength, because we have different points of view, different experiences, and hopefully we are engaged, and and we are trying to work on system level climate solutions, which again, I think is where I think that most of the big changes can come through, rather than individuals trying to figure things out on their own. I think always two brains are better than one, and so on. So we are all stronger together. So I think that's what my interpretation is. Hopefully it's okay, Ashley.
Yeah, totally. No, it's great. I think, I think that some of the parallels are kind of how the health community took on tobacco. And, that's like, you walk into a health, like a clinic or a public health department or a hospital, and there's so much about the health harms of tobacco. And we really want the kind of voice of any health place to really center climate change and like the need to address it as equally clear and relevant to health. So wonderful. And then Alex will kind of finish the foundational part with our values.
Awesome, thanks, Ashley. So yeah, these are our values. I'll just go through each. So first off, we start with climate health, right? That's climate health now. Makes sense. Our identity as members of the health community, the whole health community, like Ashley and Hina said, it's a very broad term, encompassing a lot. It's central to our role in the movement. It's extremely important that we embrace this identity and express it and share it so as to be effective as possible. Like Hina was saying, there's an influence that people in the healthcare field have, and it's important that we use that. We integrate a commitment to health, equity, and climate into everything that we do. We ground our advocacy in science. We speak based on scientific evidence. We know today with social media and the internet that there's a lot of noise, there's a lot of misinformation or misleading information out there. So we ensure that our work is fact-based and true. We understand that this is an emergency. Climate change is an urgent crisis. And the science clearly states that our time to act and avert its worst effects is very limited. As many of you know, very recently we've hit that, I believe, 2.5 degrees Celsius warming mark, or 2 degrees Celsius warming mark. And yeah, and it's come a lot sooner than I think a lot of people anticipated. I think original goals were to keep it at 1.5, and obviously we've shot way past that. And I don't know how many of you are in the LA area, but we just experienced a huge atmospheric river that brought us record rain. And yeah, things just, with climate change on the rise, things like that are just going to be happening more and more frequently. So yeah, it's very important that we, keep that in the back of our minds. It's also important to understand that this issue does not affect us all equally. Climate change affects different people from different backgrounds, different places, and in different ways. So our solutions must be equitable and centered on those most impacted. We value diversity and inclusion. Of course, the more diverse we are, the more voices we hear, the more people we understand and are able to effectively connect with and help them get involved. So we cultivate a space of equity and inclusion that fosters a diverse community of health workers. We act in partnership. Our strength is in organizing healthcare professionals. On our own, we can't do it all. So we take strategic advice from organizations and individuals engaged in policy and community work. And finally, we're moving upstream. Our clinical care is necessary, but insufficient in the face of the climate health crisis. To affect the change that we want to see, we know we must use our voices outside of that, outside of your clinics, exam rooms, and hospitals walls. And for me, outside of the classroom. So yeah, these are our values. So thank you.
Woohoo! All right, I want to be a part of the group. Thank you, Alex. So we have just one more kind of intention setting, I guess I would call it, for our group, and this is how we work together. So it's really about like the culture of CHN and what we expect. So I'm just going to go over them, and then if anybody wants to add to them, especially for the campaign team, we could do that too. So how we work together, we always try to assume positive intent. If something's ambiguous, we try to assume the best. Attend to impact, not just intention. So like I wasn't meaning to sound, rude or exclude anybody, but we also have to take responsibility for how it actually lands. We do our best to both take space and make space so that we, make it possible for everybody to contribute Some of us are really good at that. I feel like Schwinn and actually Jonathan Liu, who's not here, he's so good at saying, noting who isn't contributing and like specifically inviting them to participate. So we definitely aspire to that. Culture of safety, and I think also this is in some of our iterations, it's actually been culture of respect, respect breeding safety. So culture of a safe place where everybody feels respected, being willing to challenge our own assumptions and being, as best we can, aware of our own privilege and power and blind spots. And when we screw it up, which of course we do because we're all human, kind of reminding, sharing that with somebody of like, oh, that landed this way for me. And, it seems like maybe this other perspective isn't being recognized. So doing our best to minimize our blind spots and grow and see them. Having fierce compassion with ourselves and others. I'm trying to embrace that a lot because, I think a lot of people are doing the best we can and under tons of pressure. And so just really having a lot of compassion and understanding for each other. I think Amanda's super good at that as a model. Bringing humor, because who doesn't need more of that? Letting that be a part of our work too. Keeping our commitments to each other mostly, and what we say we'll do, and that we respect each other's perspectives, expertise, and we champion a diverse and I can't see the bottom. Can somebody help me out? A diverse and
health community.
Health community. Thank you, Joanne. Exactly. Yeah, so this has grown. This has evolved over the years. And if anybody wants to add to this, we could do that right now. Hopefully, Schwinn would be able to. I could write it down, and then I can add it later. But anybody want to add to that or guess something else?
Can I just say something quick? It's Vanessa. So I would just
please.
say that most important is showing up. You don't have to know everything, but being willing to be there. I don't know how if we said that in other ways,
mindset.
But
yeah,
growth mindset.
Yeah.
Yeah.
Yeah, I think a lot of kind of health training tends to be like if you're not the expert, then you should consult the expert, and if you don't know everything, then you don't have a place being a part of it. But that's definitely not the case. I think that kind of actually serves the interest of the oil lobby. If we feel like we have to be experts to engage, then none of us engage. But we don't have to be. We can know enough, to engage. Okay, I love that. So kind of the growth that we work from a growth mindset, or we embrace a growth mindset. I think we could add that. Yeah. Anybody else?
One additional thought is we're all leaders in this. We don't have to wait for somebody else to invoke one of these norms if they're absent or invite people in, that we all see ourselves as active leaders and take ownership for jumping in.
So like we can all take ownership for kind of stewarding these norms. Is that what you mean?
Stewarding the norms, helping to help bring those norms to life. So if somebody's feeling uncomfortable, or we're noticing that there's 3 people not participating, instead of assuming, well, I'm not the facilitator of this meeting, so I probably shouldn't jump in, that we at all times see ourselves as empowered to jump in to help these norms become a way of life.
Yes. Oh my gosh, that actually gave me goosebumps. Yes, totally. I think that gets to the like snowflake, distributed leadership model. That we can't all get it, hold it all or see it all or be aware of it. So helping each other out for sure. So how should we write that down?
So Ashley, can you just refresh your?
Oh, sure. Let me try. I think.
And then go back in. I tried to.
Like that.
It
might not if I I probably have to stop share.
You have to exit out of your presentation mode.
Okay, so
And then-
it's okay. If you add it, then it'll be in the next iteration, and we can save that, obviously. But, yeah, it didn't update. That's okay. So, but you got something about growth mindset, and then does anybody want to?
Yeah. I got show up and come with a growth mindset and ownership of stewarding the norms and help bring those norms to life.
Yeah, perfect. I love it. Maybe anybody else? All right. Beautiful. And then this is kind of, I think, the last one that's about who we are, and then we'll start talking about the work, which I have to say is very exciting. This is important too. This is important, but the other stuff is really exciting. So just in general, this is kind of, how CHN tries to operate with any with any partnership or with any specific team or, any group is just the default is that in CHN we try to get to consensus decision making, that everybody is heard, everybody shares their perspectives. We do our very best to come to consensus, and then if that can take time, obviously. So if there are time sensitive decisions that have to be made, then we kind of accept that a majority vote works, and we'll kind of move forward with that in the cases where there isn't time to kind of continue the process of consensus, which is not very common, the time sensitive thing. And everything about climate can feel very urgent, but we do our best to, let the urgency not drive to the point of, not considering things carefully. So that's our default goal. And then the other part that is helpful to talk about is if those norms, our norms, are not practiced, how do we acknowledge that? So this is easy, right? Hey, I noticed you didn't assume the best intent, or I don't know what it could be. We just do our best to have a conversation, especially ideally with the individual person, like on a one-on-one basis. That's usually kind of helps with the whole culture of respect and safety thing. So, but bringing it up, and again, everybody kind of has the permission in CHN to bring it up if we see this in a really respectful way, obviously, but to kind of mention what wasn't upheld, and then to just kind of point back to the norms that we have agreed to, and then reassess and re-agree. But we definitely don't want to be a group that lets norms not be upheld, because then that leads to resentment and challenge, and it's not a good way to continue to grow together. So even though it's really hard, and I can say community organizing brings up lots of personal kind of challenges, and that actually I've found really hard and meaningful. So this is not for people who don't want to kind of consider the possibility of personal growth too, because it tends to all come up. So and we just do our best to respectfully hear it and live the norms as it comes up. And I think I'm actually a better person. I have lots to grow still, but I have grown in really meaningful ways because of this work. So there it is. So that's the foundation, and of course, I think I've shared the slides, but we can share these slides, and this is, what we always want to come back to when we're starting something new is who we are and what we're working on together. And then I'm going to pass it to Shawin to talk about the campaign co-leads and the work that lies ahead for the year.
All right, thank you. Yes, so this next couple of slides, I'm going to talk through kind of the nuts and bolts of the campaign and the timeline and kind of the, just what it has been like. I won't say that this is set in stone, but this is generally what we found worked. And also we tried to improve it this year. So always welcome to feedback on whether or not these processes and workflows that we've made works for you guys. But the main people that each of the campaign co-leads will be working with are, of course, your co-lead, right? So co-leads, the campaign teams are going to be led by at least 2 people each campaign. And these co-leads will be, campaign besties, essentially. This partnership is really, really vital, really important, because we do rely on each other and keep each other accountable for getting the work done. And so we highly recommend that you set up that each of the co-leads set up a regular meeting to check in with each other, maybe every 1 to 2 weeks. And, they don't have to be long meetings, but we have found it to be one of the biggest indicators of success is just, having a regular time carved out in your schedule for each other. This is really, really important. The second is the campaign coalition. And I'll talk a little bit more about the coalitions, but in a couple later slides. But CHN definitely prioritizes working with a coalition. And we expect that at least one co-lead participates in every coalition call when asked or when they are held. And also take notes for the people who cannot attend, because it's very hard to remember the details later. So just making it a practice to take notes on those campaign calls. The third person that you're going to be working with a lot is going to be the coach. So each advocacy campaign, or ACC, we're going to make ACC happen. So ACC is going to be paired up with a coach. That's either going to be me, Ashley, or Amanda. And you'll meet about every 2-ish weeks. And we'll help you through, especially in the beginning, kind of the work that you're doing. And then, of course, there are CHN members. This is what we're all here for. And so, the CHN members are who we're trying to organize. And these interactions will look a little bit less one-on-one like the other top 3, but it will be, things like action alerts, education segments during community meetings, essentially, sometimes you'll have a specific task or something that you want some individuals in CHN to help you out with. And so then that can sometimes happen. Like, sometimes we find out like, oh, we have somebody who's like an expert on, a specific topic relevant to a campaign. And so we'll tap those people. All right. So that's the groups of people. And also, by the way, just while I'm talking through these slides, please feel free to stop and raise your hand and ask questions and things like that if things aren't clear. Okay.
Totally. Yeah. And if we don't see your Zoom hand, go ahead and just come off unmute. Thank you, Shwin. Any questions so far? Okay. Okay. I have to just highlight that Shwin is the artist who made this physics graphic.
No.
Love it.
Okay, so it is very hard to kind of think of a way to explain, the next couple of months. And so Ashley and I tried to represent that in some kind of diagram. But campaigns are all different, but there is a general rhythm that, I tried to represent in this very poorly drawn graph. We wanted to give you a sense of what the next several months are going to look like. So the green part is work outside of CHN, and then the bottom blue section is the time that you're going to be working within CHN. And so there is a intentional kind of representation that a lot of the work that you're doing is actually within CHN and the touch points with people. But there is, of course, external work. And so right now we're in the kind of the blue arrows on the very left. So these are the campaign trainings. And so these advocacy campaign trainings was something we didn't do last year, but we felt like would be very helpful because many of you, I know some of you have a lot of experience, but some of you, this is your first campaign that you're leading. And so we felt like these trainings could be very helpful and also just get us all on the same playing field. And so they're designed to help you feel confident and clear so that once you start working on the actual campaigns, you'll feel like you know at least the basics, right? And then the start, which is a weird little triangle thing. But once we pick the campaigns, you will start actually hopefully having coalition calls and to work with other organizations. So sometimes they're just, one-on-one organization work, and sometimes hopefully we'll get a coalition together. And so these are those little points up at the top. There is going to be a lot of coalition calls. And they do vary like throughout the year, right? Just depending on kind of what is happening. And so, probably a better representation is like a lot, and then kind of peters out a little bit, and then there's a lot again. But I was trying to make this diagram a little bit simpler. And then there's also going to be, of course, regular coaching sessions, again, with your coach. And so these are going to be a little bit more frequent in the beginning, since many of you, this is going to be the first time. And so we want to be here to support you through it. And then that's the reason why in the beginning it might feel a little bit more intense, because you'll be diving really deep in and, just going into the deep end, but we'll be there to help you. And then you'll find your groove soon. You get more comfortable with your co-lead partner, and then you'll have like a stronger foundation, and you'll have all the basics done. And so then late spring, early summer will feel a little bit more relaxed. And then the other thing to note is that, yes, we are going to be working, going to go out and work outside of the organization, but again, our goal is really to organize and strengthen our member base through this work. And so that's why, there's going to be a lot of work within CHN. And then also campaigns generally end around September. And so then that's when we get to celebrate all that we've learned and accomplished. Okay.
Yeah, I think the governor has till September 30th or something to sign. So right to the end.
Exactly.
Yeah. Any questions on this amazing graphic and what it represents? Cool. Okay. Okay, good.
And yeah, now we're going to talk through kind of what is a coalition. So working in a coalition. So another term for coalition is a directed network campaign. And so I thought there was this really cool study that I'd read by an organization called Net Change, and they studied 47 different campaigns. And they essentially identified that there are 3 basic types of campaigns based on the organizational structure that supports them. And the first kind is one that we're really familiar with, right? Like they're like the institutional organization, like heavyweights, like the NRA or the AARP, like they're huge national organizations that kind of lead that. And they have a lot of money, they have a lot of like historical connections, all that. The second is like grassroots upstarts, kind of like Occupy Wall Street or like hashtag driven campaigns or the Arab Spring. And then the third is this directed network campaign or coalition. And these are the coalitions that we build or join as part of our CHN campaign work or advocacy work. And this study that they did, they found that the coalitions between organizations are actually the most forceful and the most impactful in terms of long-lasting change, even with relatively fewer resources. And so what is a coalition, right? Because we now have established they're very powerful, but the coalition spaces are gatherings of really diverse people that are trying to work together towards a common goal. And so, for example, the coalition for, electric school buses, AB 579, where so many of you guys worked with, it was an industry group, right? Like people trying to sell electric school buses like that. So obviously they have a vested interest, right? But then it also brought together, us in the healthcare field. And then there were also teachers, there's also students, right? So there was a lot of different types of organizations. Oh, and I think we had a consumer watchdog group. So like there's a lot of different organizations and types of people in a coalition. We're all trying to work towards a common goal. And these spaces do allow for different experiences to collaborate. And that was the really cool thing, because you have a very clear goal, and everyone kind of comes at it with different viewpoints, different perspectives, but you're all just trying to pass that one campaign. So that's why the coalitions are really, really important. And I really liked this quote from Amanda Tattersall. She wrote a book on coalitions specifically, but the most successful coalitions are ones that seek to achieve social change goals, such as individual victories in shifting the political climate, at the same time as they strengthen the organizations that participate in them. So the coalition it's not just about being in this really great coalition, but each of these coalitions are made up of a lot of different organizations, and the work that we're doing in those coalitions is also strengthening our own individual organization. So that is why, the work that we do in these, like, it's great, like AB 579 passed, like, yay, right? But it also actually produced a lot of great leaders within CHN, right, through that work. And that to me is an even bigger indicator of success, when people, kind of step up because of that work that they did, because they're like, oh, wait, this is actually really cool work. I want to continue doing it. All right, so next slide. So then what is it like to work in a coalition? So what is our goal in working in these coalitions? Because I've talked about kind of at a high level, what's the purpose, right? And what they are. But CHN's goal is really to learn, when you're in these coalitions, you do learn about the ongoing kind of political context and the strategy from other organizations and, lobbyists that are sometimes part of this, if there is some money for a lobbyist. And so then they have the know-how that I certainly do not have, right? Working in healthcare, like, I don't know that much about, specific, like, kind of the who's into what kind of like political atmosphere, but they do, right? And they know who has the power, who, like, which chair, who is the decision maker, all these things. You learn very fascinating things about committees that are kind of weirdly undemocratic, but anyway, that's the stuff that you learn. And we in CHN, like, just kind of the makeup of who we are. We're not necessarily the politically savvy or like, know kind of the current climate of whichever legislative body you're working with. And so the coalitions are really, really good to learn from. And they will tell you all of that. And then the other half of it is to really bring our health voice and the health lens to strengthen that campaign. And so, this is the reciprocal, right? So, like, we're getting information and learning, and then we are providing that health voice. And sometimes, there are other health organizations as well. And so that's why it's alone and or in partnership. So I'm going to go through a couple of examples. Actually, one I'm going to talk through, and then the second I'm hoping Vanessa will be able to talk through. Oh, wait, nope, go back. It's okay. I guess you can do this one, but
Sorry.
that's okay. The first one is actually, I wanted to talk through not having a coalition. So AB 579 in the beginning did not have a very clear coalition. And so this is where I think Lisa is on here, and I see your smiling face because you are the one who really helped bring this together. So when we started work on AB 579, which is electric school buses, we got connected to individuals who are working on things, like Lisa, but we didn't actually, like, there was no coalition call we could just like sign up for. We're like, oh, okay, let's just attend. And so sometimes there isn't a coalition. So I just want to pull that out there, that is a possibility, right? And so we started with a couple of contacts, and, we talked to, the bill was sponsored by Assemblymember Ting. So, we connected with the staffer that was in charge of that bill. And then there was an industry group that, we were also introduced to because they were the bill sponsors, right? And then we connected with Lisa because she had authored a great org sign-on letter that, had been sent out before we even got involved. And then through that, we realized, wait, So you guys, like Lisa, had already reached out to some organizations, and then through our kind of talking with other people that were involved, realized there's other organizations that could be involved. And then pretty soon we kind of had a little mini coalition that was going on, right? We were able to bring in, other contacts and organizations that we had been talking to and that we had gotten through sign-on letters that we had written, and then we could kind of piece together that coalition. So just so everyone knows, there is a possibility sometimes when we pick a bill that a coalition hasn't been formed yet. But we do encourage that, we will help you through this, but sometimes we do have to kind of piece together a coalition. I think SB 394, though, already had a coalition and that was already established. So sometimes we have one, sometimes we don't. And then I'm hoping Vanessa can actually talk a little bit through about that kind of like multi-directional relationship in a coalition of how, we help each other out and we share resources.
So I just want to say, I think it's really exciting to be involved with these bills, and see just how much impact we have. Yeah, Lisa kind of started us to know what this was all about. And, that coalition, I think, forms easier than you might think in a way, because there's different groups with the same interest regarding these bills, particularly the electric school buses. I mean, there were the teachers, there were the parents, the PTA, there were even some people who were resistant on school boards, but other school board members who actually supported and helped move it forward. And it was the American Energy United who was the sponsor, who brought the bill, to Ting's office and asked him to, they used the word again, sponsor the bill. And just to say, it is a lot of back and forth. One of the things that was important was to speak our voice in terms of the health impacts. Wendy Wing and I made like a health fact sheet that said, why electric school buses were a better alternative to diesel. I mean, there's a lot of scientific information to support that. So, we were able to share that within the coalition. And when we spoke to legislators, the other thing is, that the health impact is realized somewhat. I think particularly the last legislative session with what was happening regarding climate health brought, how people were being directly impacted, right, with fires and increasing temperatures and things like that. But also what we found as a big factor is sharing what happens if they don't do something in terms of the health impact, what that financial costs. Because when you're dealing with the lobbyists, particularly on the other side of whatever issue, they know that that's always going to be a concern, the cost. So I think we had a lot of information to say, yeah, this is what happens, how many days of school absences there are, how hot the buses get, how much air that's really toxic those kids driving inside the diesel buses are exposed, those kind of things, as well as, asthma and all that. So yeah, I think it is something that at different levels, people were engaged, and actually Schwinn's graph, because it's like, undulating there, in terms of when things are happening, matters. And then the legislative aides for the state senators and representatives are like, they're looking to you for information about the health impacts. So you might not think you're an expert, but just saying your story, what you've experienced, that matters a lot in terms of being a healthcare provider and health impacts. So
Yeah,
is
and I
that
think
good,
we
Shwin?
totally, yeah, thank you. We also work together to kind of create those health specific talking points, and I think Vanessa, your point about, there's the cost of doing something of the bill, but then there's also the cost to health if we don't do something, and that can be a question that is pretty unlikely to be asked if somebody from the health community doesn't bring it up. So thank you. Yeah, that was perfect. And then Shwin is just this is like the logos we wanted to represent.
Yeah. So this is we were talking about, maybe like this is essentially like the graphical representation of what a coalition looks like, right? So this is actually an ad that was placed in the SAC-B for SB 394, which was the climate action plan one. And these are, they also had a coalition. Like I said, it was a more established coalition. And so then these were all the organizations that CHN worked with in that coalition. So that was just a cool, like they actually have something together, like an ad that
Totally.
has.
Yeah. Yeah. And then, Amanda was going to do this. So we wanted to talk through like an example, which is this ad, and how the organizational decision was made to be a part of it. So, because this is going to happen, and there's going to be questions that come up in the coalition that you as our campaign co-leads are going to be a part of, and they're going to say, oh, what we need is the health community to do X, and then you all will be able to communicate that to us, and then we'll make sure that we can do that, kind of in terms of bandwidth and all the things to make it happen. So one pretty straightforward example, but just to kind of show the framework, is that the SB 394 coalition, which wanted the master plan for climate resilient schools, they said, CHN, we're putting this full page ad in the newspaper, and we would like to include your logo on it, which sounds really cool because we're obviously supporting this. But when we put our name on something, or when we have a speaker doing something, or when we ask our members to call their representatives to say something, we just need to kind of run that through the different teams to make sure that we can, and that it makes sense, and that it's scientifically based, kind of those types of questions. So the campaign team would then share the request or the proposal from the coalition with their coach. And in this case, it could be, like Shwin said, it could be Shwin or me or Amanda. So then Amanda would run it by the other statewide leadership team coaches, because we're going to be aware of, at least 2 campaigns, possibly 3, depending on if we attract another campaign co-lead. So then we just have to make sure that we can do it in terms of organizational bandwidth, that something else isn't happening like on the same day, if it's a press conference, or just bandwidth wise, if we can do it. We just have to make sure it lines up with our policy platform, with that it's scientifically based. Like they might be asking us to speak to something, and we would have to just make sure that that all is scientifically kosher, all those types of things. So the campaign co-leads will kind of communicate to their coach. The coach then will have the responsibility of running it by the other coaches and kind of making sure coordination is happening. And then we have a clear decision. And like I said, we haven't had these teams before, so there's gonna be bumps, there's gonna be challenges, but this is sort of the flow of communication that we have in mind. Any questions on this, or feedback, or anything? All right, cool. And then this is sort of just illustrating that there's the campaign co-lead interacting with the coalition. The campaign co-leads, the coalition, the coaches. Those are the key players that Shwin has talked about. And then, what we're trying to do is get all of our 800 or 900 CHN members across the state to like most powerfully bring their health voices to the campaign so that we win. But this little micro team is kind of the way to mobilize and communicate with all the CHN members. I already went through it. I forgot about that. Okay. Oh, cool. So we're running ahead of time, so do pipe in if you have any questions or feedback. But this is going to be kind of walking through what are we going to work on and how are we going to decide that. So we have a process, and this year the campaign co-leads are kind of the big growth step. And a couple of years ago, well, I guess just last year, was the first year that we got really deliberate about how to choose. And so this process, we've gone through it once, but it's actually, we're iterating, and it's getting better. So this is the whole, the steps of that process. So the first step of the process in determining the 2 or 3 campaigns that we work on is basing in our mission, and where our mission, kind of the policy platform that we use to guide our mission, is called the U.S. Call to Action on Climate, Health, and Equity. It's a 10-point policy action agenda that has been signed by, I think 300 health organizations at this point, AMA, CMA, like lots of nursing organizations. It's kind of the consensus agreement of the health community at this point about what needs to be done in terms of policy. So that's the first step, is it has to align with that, because that's our foundation in terms of what our policy priorities are. And then in just 2 weeks, our advocacy advisory team, we sometimes call them the AAT, that is a group of 5 or 6 people who are experts in California climate policy. They are not experts in health. We have one that has some kind of overlap, but these are people from groups like the Green Lining Institute, which is an amazing environmental justice leader nonprofit, the Public Health Institute, the Coalition for Clean Air, the Climate Center. So these are groups that have policy analysts and they have like the capacity in their organizations to go through the 1,000 or 2,000 bills that are introduced in Sacramento, and they also know about the regulatory campaigns that are really important. So last year we worked on one with the California Air Resource Board, which is the agency that is like in charge of mapping California's progress towards the climate achieving our climate goals. So this is an external to CHN group. These are not CHN members. And in a couple of weeks, we're going to meet and we're going to say, okay, we have the health community, we have members in the health community. This is our policy action agenda based on the legislative bills that are going on this year and the regulatory efforts that are going on this year. Where do you think our health members' voices can be most impactful in winning? That's our question. So we asked them for a list, and then we the statewide leadership team, which Margie and Brenda and Schwinn and Amanda and I are part of, and then we have input to that. We have this matrix we could share with you if you want. And then our campaign co-leads are going to have input, and we're going to have a meeting to talk about the list in a little, like 5 weeks or so. And then, for the first time ever, we're going to also send our list to our members in email. And it's not going to be like a perfect democracy here. Our election campaign, the voting process is not like perfect, but we're going to poll our members, which is really cool because we haven't done that before. So we're kind of going to get a pulse on like what people are really excited to work on, because they're going to be the ones who help do this work along with all of us. So that'll happen, early mid-March, and then our goal date is the end of March, the 25th, to decide. And we'll have a list, and the list will probably be, 1 to 8 or 10 campaigns. Usually it's mostly legislative, but then there's a couple of regulatory campaigns. And then we get to, we find out who's in the coalition for the top 2 or 3, depending on how many co-leads we have, and then we get to work. So that's the process, and we did that to try to really get as much input as possible. This is my representation of democracy happening. So questions? Any ideas, feedbacks, questions?
I had a question. I think it was just answered by what was put in the chat. I was wondering if we could get a copy of the U.S. call to action so that we could read what their agenda items are.
Oh yeah. Thank you, Schwinn, for dropping it in there. Yeah, it's definitely worth a read. There's a 1-page version, and then there's like a 5 or 6 page version, but it's really well done. Yeah. So.
Super. Thank you.
Yeah. Any other questions or feedback? Cool. All right. Well, the process is going, which is pretty awesome. And then I just want to say, so Anne Harvey is here, and Rachel's here, and Mary's here, and Lisa, we've already asked you. And yeah, so if you all are like, oh my gosh, this sounds really exciting. I don't know where to put my energy around climate, but I want to focus it. If you feel like you should be a campaign co-lead this year, we'd love to hear from you. It's a big commitment. Not going to, be unclear about that, but it's also going to be really awesome. And so if that itch is, if you feel that, let us know. We will put our emails in the chat to invite that communication if you want. Cool. Yeah. Any other questions or comments or? Yeah, Margie, I see your hand.
Unmuting. This is awesome. It's really great to meet all the new leaders, and it's really going to be fun to work in teams, I think. So my question is from the membership perspective. How do members get to join these campaigns? What do you see the membership doing? How can they contribute?
Yeah. It depends. We'll have to see. Like my sense is that it will come from the coalition. It'll come from ideas of the co-leads of what is important. What we're basically as our goal is to join the coalition and say, this is who we are. This is what our goal is. Like how can the health voice most impactfully help this campaign win? And then in terms of the tactics and the actions that we take to do that, it's just going to depend on where things go and what's needed. So, examples we've talked about from last year, but maybe it's that the campaign coalition says we need, 20 nurses and clinicians to come to this committee hearing in Sacramento on Thursday to give testimony about the health impacts of the bill. Or we need a letter to the editor, or we need an op-ed, or we need, those types of things. Is that what you meant?
Partly, but how do we engage them so they're, those are episodic things, and that happened last year. There's a call to, we need people to show up, but how can they engage in the whole process so they feel like they're really part of the campaign?
Yeah. Do you have any ideas?
It's really what the work of the co-leads are going to be doing. I mean, do they want members to be part of that process of developing a campaign or figuring out, reaching out to coalitions? That's the thing. How do we plug people into this campaign from the ground up, so they feel like they also own it?
Mm-hmm.
Is it okay if I jump in to add
Sure.
something here or add something? I love what you're saying, Margie. And as far as I'm concerned, as one of the ACCs, I would welcome and encourage members to join whatever campaign I am co-leading, because I think that's a key. It's going to take a village to do any of these, and the larger the piece that we're biting off, the more it's going to take a village. And also the more we can keep our membership actively involved, the better off we're going to be. So I would just speak for myself and hopefully for whomever I team up with, that I and hopefully we would welcome huge membership involvement and hopefully create that process as soon as we know the topic that we're working on. My goal would be to how do we create a process where any member who wants to join us can.
Mhm. That's great because, you know, I do the new member onboarding. And so they say, well, what can I do? Or, you know, I would like to offer them and plug them into your campaigns, you know? So I could explain what the campaign is that we're working on. And if that's of interest, then like, can I hand them to you? You know,
Absolutely.
so we'll
It
have to
kind
start a workflow. Yeah.
Yeah, it makes me think, sorry, to go back to this and like whoa, back and back and back. So one idea, and this we'll see, and we'll totally be here to support, you know, the exploration. So one idea is that maybe the campaign co-leads for campaign 1 or campaign 2, maybe they host meetings where we invite any and all CHN members to come.
Mhm.
And I can set the power base up, the event up for that, and we can invite. But this is like a new capacity that we did not have last year. So I love the brainstorming. You know, and that could be the campaign co-leads are meeting, you know, with some rhythm, but then maybe it's also there's like a campaign co-lead hosting other CHN members who want to participate. Maybe that's every month, or maybe it's based on specific times in the campaign, or, you know, it's to be created, and also what's able to happen with the rest of our obligations. But this totally up for creation, really. Yeah.
I mean, I was thinking, yeah, if it could be announced in the monthly meeting or in your newsletter, like inviting members that if they have interest in contributing or participating, and then we can, you know, do the meetings and that kind of thing. So
Yeah.
something like that, and making it
Yeah.
like a recurring invitation sort of thing in the meetings, just, you know, to invite people in if they have, you know, time or space to participate or something like that.
Yeah, like in the community meetings. I see your hand, and we'll come to you next. In the community meetings, we could definitely, you know, like what I do is usually run by the different team leaders. So, do you need some agenda time? What do you want to talk about? Do you want to do a breakout? Like maybe we do breakouts, and they get to meet the campaign co-leads, or but these are all things we can do only because we're doing it together. You know, it's more possible because of the many hands. We'll go to Anne first, and then to Rachel.
Hi, I was just going to say I can't step up to be a co-lead, and I'm more because I'm retired and I'm not really my own identity is not so much as a doctor anymore, but I feel like I would like to be in relation to this advocacy team for, as people are saying, the occasional be there for the meeting with the legislator, but also I was just thinking when you were describing the there not being a coalition for the school buses to start out with, so maybe there could be, for people who are just interested in the advocacy work, emails or whatever that goes out occasionally about what's going on, because I happen to be aware from like 10 years ago, I got a handout at some fair about and I don't know if they were state or national, but a group that was working to electrify school buses. And so I'm involved with other environmental and equity organizations, so that maybe things like, you know, being able to at least let the leads know about other groups that I know about that might be interested in my area, that aren't being a lead, you know, but that there might be all sorts of things like that, that people who are interested in the advocacy but don't have the, you know, either from their work time or their other whatever, they are not going to be spending a lot of time on this, but might have ideas or knowledge or sometimes things they can chip in.
Yeah,
You know?
I see that email, which is like share your network with us. And it's like, the team working on X campaign doesn't have a coalition. Like we're helping to build that. If you know of any organizations whose mission aligns with this bill, call Alex and Thea, or whoever. I think we could definitely do that. And so the sense that I have is that the campaign co-leads will communicate to Amanda and I as staff, and then we could share out those communications to all of our members to kind of get the word out. Yeah. Thank you. Great, Anne. And I love that. And I think, so many people have, certain people have lots of years of experience and know different orgs. And so we can really share that network. And we'll go to Rachel next.
Yeah, hi everybody.
Hey.
Yeah, I just wanted to comment that I definitely fall into the category of like being very busy, but wanting to learn more about how to be more engaged with like statewide climate health advocacy. And so having it be like, yes, there are two co-leads, but perhaps also, those co-leads are leading like a team including CHN members, where they can kind of disseminate specific calls to action that are like tangible, discrete, or even more longitudinal, but just maybe not to the same level of time engagement as like being a co-lead. So yeah, that was my 2 cents. So I appreciate that. I appreciate that all of you like asked that question and provided those solutions, because I think that is something that I'm really interested in as like a busy working mom, physician, etc., that wants to learn more and be involved, but just can't really be a co-lead right now.
Oh yeah, for sure. I think that that's the beauty of the group, is that we all kind of come up for air and contribute, and then we get swallowed by our lives, and then we come back, and it's all about the team that keeps it moving forward, like a relay race or something. Lisa, and then maybe we'll go to our closing.
Oh gosh, this is a fantastic meeting. I am so impressed at how you guys are organizing around this. This is just wonderful. Thank you so much. And one thing that I know will come up, I was wondering if we'll have a process in place when other organizations say, hey, would CHN sign on to our letter in support of this other bill? Because, outside of the several that we'll be, doing with our statewide coalition.
Yeah, like we have our deep dive campaigns, and then what about all the other things that we also, on our principles and values support? That is a great question. So as it is now, the way we navigate that is basically we get an incoming request to, co-sign a letter for banning oil drilling or something, but we can't do a full campaign on it. If it aligns with the call to action, basically we kind of run it through the call to action, and then it aligns with our policy platform. And then if it does, then we sign it. So yeah, that's where we go. We just look to the hymnal, which is great. So that's the way we navigate it. So that's how we imagine doing it this year too, is being able to sign in support when it aligns with our policy action agenda. Yeah,
great.
Good question. Yep. I know, I wish we could do it all, but focus is also beautiful. So we're closing up. We're on time. We're going to have a good afternoon. The next steps, we just want to finish with this, and then we'll wrap up. And we really appreciate 90 minutes is a lot, so we really appreciate you all, investing this time. So like I mentioned, the Advocacy Advisory Team, our policy expert advisors, we're going to get together along with the campaign co-leads on Wednesday, February 28th, and that's from 12 to 1. You all have a calendar invite somewhere in your tech, I imagine, and so if you could just invite that, and this will be really the Advocacy Advisory Team members kind of sharing their perspective on why they think the health voice would be valuable on those whatever campaigns they're suggesting. So it'll be more of a moderated panel than a whole group discussion, because it'll be a pretty big group. But that is the next thing. And that's, focused on flushing out the list of things that we consider in terms of campaigns. And then the next advocacy advisory session, March 6th, is actually going to be with Lisa Chang, who is with us today. And she will help us all feel a little less ignorant on the California legislative process, which is really confusing. And how does a bill become a law in our state? So that'll be really fun, lots to learn. And then the third of this series, of the advocacy training session, number 3, will be with Shuin Chang about the anatomy of a campaign. Like, what does that mean? What are the pieces? What does tactics mean? And that'll be Thursday, April 4th, 12 to 1. And then once we have a really clear sense of our campaign, priority list, and we know if we do attract a 6th campaign co-lead, then we'll be able to do 3 campaigns. But if it's the 5 of you, then we'll do 2. So there'll be a dyad on one and a triad on another. And then those the campaign co-leads working on a campaign together, the plan is to meet in that little micro team in kind of the second week of April. So kind of TBD, but that will be coming. So that's it, y'all. We covered a lot. If anybody, we always do, right? If anybody has any feedback, we would love that. If you think maybe I talked way too much today, I would embrace that. Or any feedback about what went well, what could have gone better. We're always open to feedback. So you can just email us if you want or put it in the chat. And that's it. That is it. Yeah, so thank you so much, like I said, for spending your 90 minutes with us. And please do reach out with any feedback or questions or interest. And otherwise, we will see you in a couple weeks. You can probably stop the recording, Shuin, if you can.